Good afternoon, everyone. This is Dr. Bhupesh once again from Dr. BKM Institutes. Today we have got a speaking topic, but before speaking topic, I would like to share a couple of good things with you. First is that you can take offline classes now from onwards. So anybody who is interested in the offline classes can contact us at 7696734256. Those classes would be commenced at Gyan Sagar College of Nursing at the moment, and let's see how it goes. And apart from this, whenever it comes to speaking topic, we had yesterday a few things which I told you about the format of the speaking, like the way I'm connecting to you right now with the videos, which I normally do not. But that is why I do not, because now you can see my hands moving. So you can see my gestures, you can see my facial expressions. In OET, these expressions are not required. They do not have any marks. It's all about your tone, the confidence you have in your voice that will be counted. So there is no marks for the facial expression. So even if you do the whole task by looking at your role play, okay, how are you feeling, Mr. John? Okay, Mr. John, are you feeling better? So you can do whole of the task by looking down. You don't have to look at the examiner even. So that will make you less anxious. But if you're talking to the patients in your normal routine, देन ऑफ कोर्स यू कैन डू योर वे, क्योंकि अगर आपको पेशेंट से इंटरेक्ट करने की आदत है तो आप पेशेंट की तरफ देख के बात करना ज्यादा कंफर्टेबल फील करोगे. तो अपने ऊपर डिफरेंट एक्सपेरिमेंट्स करके देखो व्हाट इज बेटर फॉर यू, व्हाट ग्रोज ऑन यू. फॉर नाउ आई एम जस्ट गोइंग टू डू वन ऑफ दिस स्पीकिंग टास्क ऑफ टुडे. बड़ा ही सिंपल टास्क है. आप हॉस्पिटल कैजुअलिटी वार्ड में हो. द पेशेंट इन द हॉस्पिटल फॉलोइंग अ रोड एक्सीडेंट. द पेशेंट कंडीशन इज स्टेबल बट ही हैज लॉस्ट ब्लड एंड नीड्स अ ब्लड ट्रांसफ्यूजन. सो बेसिकली पेशेंट ने ब्लड लॉस किया है, कैजुअलिटी वार्ड में आया है, यानी इमरजेंसी पेशेंट है ऑफ कोर्स. द पेशेंट डज नॉट अंडरस्टैंड व्हाट विल हैपन. द पेशेंट इज एंग्शियस अबाउट द प्रोसीजर. तो उसको पता नहीं है ये ब्लड कैसे ट्रांसफ्यूज होता है. फाइंड आउट द पेशेंट कंसर्न. तो वो अपनी कंसर्न बताएगा आपको. रीअश्योर द पेशेंट दैट पॉसिबिलिटी ऑफ इन्फेक्शन इज वेरी स्मॉल एज केयर इज टेकन टू स्क्रीन डोनर्स. तो यहां से आपको समझ आना चाहिए इन्फेक्शन वाले पॉइंट से कि मोस्ट प्रोबेबली पेशेंट इन्फेक्शन की बात ही करेगा. तो उसको बताना है कि रिस्क इज वेरी स्मॉल रादर नेग्लिजिबल एज केयर इज टेकन टू स्क्रीन द डोनर्स एंड टेस्ट डोनेटेड ब्लड फॉर पॉसिबल इन्फेक्शन. और जो ब्लड बचता है उसको भी अच्छे से टेस्ट किया जाता है. Explain the procedure of blood transfusion. Keep 0.9 needles would be used. Sterile conditions would be there. New syringes would be there. Nurses watch it closely. तो आपको बहुत ध्यान से हम प्रोसीजर करवाएंगे. And stress that the patient really needs the transfusion in order to recover fully. और इस बात पे स्ट्रेस करो कि पेशेंट को ट्रांसफ्यूजन चाहिए रिकवर कंप्लीटली करने के लिए. सो मैं आपको टास्क बोल के दिखा देता हूँ. गुड मॉर्निंग, माय नेम इज भूपेश. आई एम अ नर्स हियर. So could you please tell me what happened with you? Well, nurse, I had a very bad accident, and yes, of course, I can see that you had a road accident, and I can see that you have lost a lot of blood, and that is why doctor feels that you should have a blood transfusion. Oh, nurse, I don't want to have a blood transfusion. I am really worried. Okay, so could you please tell me why do you feel that you should not have a blood transfusion? Because as per doctor and as per us, you have lost lot of blood. So only the blood transfusion can help. So I would really like to encourage you to have blood transfusion. But nurse, I'm really scared about blood transfusions. I've heard, even in the past, my grandfather had a kind of a transfusion, then he had infection. Then I have heard of many stories. I have read that infection can travel, even HIV can travel through blood transfusion. See, don't worry. We do understand these things. Being medical professionals, we have addressed this concern. Earlier, the blood donors were not screened, and also the blood used to be contaminated. But as per the guidelines of WHO now, each and every blood transfusion that is taken from a person, that means the blood donor is always screened. That means the blood donor is always screened. That means he is tested for any kind of virus. So only after finding that the patient does not have any kind of viral infections, whether long term or short term, then the blood is taken from the donor and then it is collected, and it is without any kind of infection. It is again tested to make sure that there is no infection in the bottle itself. Then it is transferred to you. So when it is transfused to you, then there can be no chances of infection. So the possibility of infection that you are talking about is negligible. Rather, I would say is impossible. So please try and understand these issues used to happen in the past, but in the modern times, nothing like this happens. So you don't have to worry about anything. but nurse, there would be a lot of pain, needles and all that stuff. Well, I do understand. It's just kind of a bee sting. It's a small pain that will happen. So a very thin needle would be inserted, and then we would have all the sterile conditions. The syringes would be new, and nurses will watch you closely, and the pain again would be almost minimum. Like it would be negligible or would not have any pain. So please try and understand the issues that you are having are not really valid in today's time, as the needles are very thin and the infections are also well screened. So there are no chances of infection and no chances of pain. But nurse, isn't there anything else that we can do? Well, I'm afraid to say that there is nothing that can help you to recover except for the blood transfusion, because in your case, the blood that you have lost is massive. It's lot of blood that you have lost. So in that case, only the thing that can help is blood transfusion, and that is the procedure that we need to do right now. So please give us the consent to transfuse the blood, because it is very important. All right, nurse. Okay. Okay, thank you for agreeing. And again, I would like to repeat that there is nothing to worry at all. There are no chances of infection and the pain would be very minimal. And the last thing is that it's very important at this particular moment to have this blood transfusion. And there is no other way out when it comes to restoring your blood level. Okay, nurse. Okay, then. So we are just about to start the procedure. If you will have any question, please let us know. So this is how you execute the task. And when I have the video, then also I get distracted. In exam, you will get distracted by the examiner. So as I have always told you, just consider the examiner as only a patient. So don't get worried, don't get distracted. Look at your role play card, write on the role play in the first 3 minutes that you will get for the preparation. First line, as I always say, should be written, "Good morning, my name is Bhupesh. I am a nurse here and how may I help you." So ये पहले लिखा होना चाहिए जब आप कैजुअलिटी वार्ड में गए हो. अगर डॉक्टर ने पहले ही देख रखा है, जैसे इसमें नहीं दिया था तभी मुझे टाइम लगा, तो मुझे एक चीज सोचनी है. अगर डॉक्टर ने पहले ही देख रखा है, "Good morning, my name is this. I am your nurse for the day, and as told by the doctor that you have lost lot of blood, so you need a blood transfusion." First line हमेशा लिख दो so that you can be at a specific pattern. Because if you have two things in mind, like in my case, I had two things. Doctor वाली line बोलूं या ये पूछूं कि how may I help you? So I get confused. So sometimes you have to trust yourself, trust your intuitions, and go according to that. But don't worry, you will do fine. But keep talking in English. That is the only way you can practice. 3 minutes you will get in the role play to prepare. So write it. 5 minutes to speak, and every point is not important to be covered, but speak it for 5 minutes. Develop a habit of talking to yourself for 5 minutes, like the way I am talking right now. So it's very important to develop this habit if you want to clear OET, because examiner can be extremely reluctant and will not reply you at all. So you will have to do it yourself. So this is Dr. Bhupesh from Dr. BKM Institute. Our contact number is 7.
Please like, subscribe, and hit the bell icons for the free OET coaching videos.